I think your illness is not your identity, or at least it doesn't need to be and it shouldn't be. And so, if you're currently there, can we move you away from that so you can have a much more complicated and nuanced identity as a person that promotes robustness to the challenges of life as opposed to makes you fragile, right? Also, some people, not everyone, I'm going to say this as clearly as I can, some people, a segment of the population, I don't know how large a segment of the population it is, but there's a segment of the population who have a diagnosable mental illness who use their mental illness as an excuse or a scapegoat for their behavior. This happens with PTSD sometimes. Some people with PTSD use their trauma as an excuse for their bad behavior, and that's not clinically okay. If you have serious trauma of whatever kind, and it's left you with aggression reactions, rage responses, whatever the behavior, it is your responsibility to take ownership of those experiences, find ways to mitigate those rage responses so that you can live a more functional life. We can certainly be compassionate for people who have a diagnosable mental illness like PTSD, but just because you have trauma gives you no excuse to be a shitty person. And so it's very important that compassion is not an excuse. Compassion is an understanding and a sympathy for people, but not an excuse for behavior that's counterproductive for your personal well-being and the well-being of the world around you. For instance,